your medical records, you're from Denton, Texas?
You're you're on mute.
So sorry. Yes, I'm in Denton, Texas.
Okay. What's the story with the mold in your house?
I believe at some point we had a water leak.
Okay.
The kitchen and bathroom share a wall. So I think the water leak was in the kitchen, and we had some mold in the bathroom, but most of it was under the kitchen sink and also under I don't know. They're discovering right now. They're pulling all the sheetrock out and looking for it.
And that really affected you?
Well, not for a long time. The leak was a very long time ago. I didn't notice I had any mold sensitivity until after just really recently. I got in my car and noticed a tightening in my chest, and I started getting dizzy and feeling really bad. And I believe we have mold in my car also. So I think I've become sensitive to it.
Yeah. You ended up going to the hospital for that, right?
No, I went to the hospital because, let's see, 4 days after my biopsy, I started having sharp stabbing pain. Sure. And it went from between 0 to 10, it went to an 8. And my left arm was numb. And Cindy said, that sounds like it could be heart attack. Yes. So they wanted to rule that out. And when they did the CT scan, they saw other things.
Sure. But I was getting to the point that you were having tachycardia and shortness of breath. I saw on a note that could be related to the mold. Okay. It's like it's mast cell activation. Okay. So that could be related to the mold. I'm talking about independent of when you went to the hospital, the tachycardia and the shortness of breath. Could be that.
But I was not in my house, by the way. I've left my house. I went to the beach for a month, the month of February, and I went directly to my daughter's house, and I don't have any sensitivity there. There's no mold. So I've been away from the mold for a long time.
Okay, great.
Lindy, when you were still in the house and you and I were talking, you said that you would get that tachycardia, like your heart would start racing, and when you were exposed to it.
Okay. Yeah. Thank you.
Mm-hmm. Then you do have sensitivity to it. That's what I was trying to get to. Thank you for translating, Cindy. Okay. All right. Now, you didn't take any COVID shots. I congratulate you for that. And anyone around you took any COVID shots?
I don't live or interact with people that I'm aware of that did. Most of the people in my circle, I think, avoided it.
Good for you. Good for your circle. That's good. Okay. So, when was the first time that you felt your breast mass?
3 years ago in July.
Okay. And what happened then?
I had fever and extreme pain, similar to when I used to have mastitis with all the children.
Sure.
There was it was like this filling up in my breast. Okay. And I looked down, I was like, oh my goodness, what is that? I mean, I felt the sensation of the filling up. And I used superfood nutrition, and that took away the pain and the inflammation, and it even shrunk it down from like a golf ball to like a marble. And I felt great for about 2 years.
Okay, so you never went to the doctor?
I did after, I think I felt great for about 2 years, but when the kids started noticing, I guess I was a little slower and starting to feel a little more weakness. they were like, Mom, you really need to just at least track it and make sure. So I started going to a thermographer and getting images. And my first 2 images, he said, there is inflammation. He said, at this point, it does not look concerning. The 3rd image, he said, okay, now it's time to go do something about this. It looks concerning.
Okay. And you have a family history, right? Your mom had breast cancer?
No, she had lung cancer.
Oh, lung cancer. Okay. I thought it had been breast cancer to the lungs, but it's no. She had lung cancer. Okay. And she's still alive?
No, she died of lung cancer. I don't know if it's been 10 years. And my grandmother had breast cancer.
And she died at 57?
Correct.
Okay. And your mom died at what age?
I think close to 80.
80. Okay. And was she a smoker?
No. I didn't think about that. She had lung cancer. I'm having trouble breathing.
Okay. All right. So sometimes after the biopsy of a breast, there is bleeding inside. Okay. And that causes pressure and extreme pain. And I think that's what might have happened. You know, when they go in, they use a thick needle. It's called a trocar. And that can cause bleeding, inflammation. And if the mass is large, it can expand, okay, into the soft tissues. And it's very close to the axilla where the nerves and the blood vessels go by. And that's where I think you were feeling this extreme pain. Because if you're saying 8 out of 10, probably for me it would have been a 15, because men have much lower pain tolerances than women. Otherwise, the human race would disappear, right? You know. So I'm sure it was extreme pain. Okay, all right. So I saw the pathology report. I went through everything, and there's a couple of things that jump at me. One, your white blood cell count is low. Okay, and the medical oncologist made an annotation about that you have leukopenia. Okay, so the main reason why people have leukopenia is because of something that they're taking. So I saw that you're on a list of supplements. More likely than not, one of them is causing the leukopenia. I don't know which one, okay? But has anybody ever told you that you have low white blood count?
Wasn't it Dr. Rodney? Didn't he say?
Maybe. That was, what, a year ago? Or
Yeah, I went to see a holistic doctor who ran a very comprehensive blood test. And he said the blood test showed low white blood count. He said something is kicking the poop out of your immune system, is what he said.
Okay, so well, that could have been the mold also. You know, you were getting exposed there. Okay, but we'll evaluate to see what's causing that, because one of the medicines that they're recommending you to take, the aromatase inhibitor with a CDK4/6 inhibitor, that the CDK4/6, okay, those can cause your white blood cell count to come down. Okay, so it's one of the side effects of those medicine. So if it's a side effect and you're not starting with 5, you're starting with 3, you're gonna tolerate less of it. Okay, and these medicines are good. Okay, these CDK4/6 inhibitors prolong life. They make the aromatase inhibitor work for a lot longer. And I think that you can do very well. Wow, the noise went away. Oh. Okay. Okay. And I think you can do really well for I'm talking about many, many years. So I think the oncologist has a good plan. I think for you to get an aromatase inhibitor with a CDK4/6 inhibitor, it's a good plan. I think it's the standard of care. I think you being healthy, some others would have chosen chemotherapy first. Okay? So the fact that he didn't shows that he's conservative. I don't have anything against chemotherapy. I just want the best for you. And I think there's always time for chemotherapy. Okay? So if you were to need it in the future, look at Lance Armstrong. He had 4 brain metastases. He did very well. He went on to win 7 Tour de France. Okay? So there's a place and a time for things. Okay? So not all chemo is bad, and not all traditional medicine is bad. So some of it is good. And I think the aromatase inhibitors with the CDK4/6 inhibitors, in your case, would be a good thing. I think they're going to shrink the tumor very quickly, and they're going to, whatever skin changes you have in the breast are going to get better with these medicines. I also think that the Zometa or the zoledronic acid to fortify your bones is a great idea. Okay? To have it every 3 months is good enough. So let me tell you about some of the side effects. The aromatase inhibitors thin out your bones a little bit. That's why taking the Zometa helps with strengthening the bones. Also, taking the vitamin D, and I saw that you have a level of 119, is great. Okay? And that will strengthen your bones. Okay? But the aromatase inhibitors in some patients can cause a lot of joint aches. Okay? So I know you haven't started treatment yet, but you may have some joint aches. If they become intolerable, we may need to look for another pill like tamoxifen. Okay? If the aromatase inhibitor gives you too much joint aches. Okay? Then the CDK4/6 inhibitors, they just make the aromatase inhibitors work better and for much longer. Like it adds another 18 months to 2 years to, if you were going to respond with the aromatase inhibitors, say for 1 year, now there's a chance that you can respond for 3 years with the same treatment. Okay? And then there's many other treatments. There's, like 15 different treatments. Okay? So the first thing is that I want to tell you is that I'm hopeful and I think you can do very well. Okay? For a long time. So, so far, any questions?
Okay, so are you saying that what Dr. Melmed is recommending, the hormone blockers for me are good and can provide more longevity that are quality, potentially, but my white blood cell count is too low for them and we need to do something about it? Do you think it's because of the mold? We are getting the mold out of the house, so is that going to help me?
I think it could be the mold or the supplements that you're taking. I don't know how long, for instance, you've been on these things. We need to go through that part of the history. It could be one of the supplements lowering your white blood count.
Okay, how can we find that out? Do we have to?
Okay, so getting back to your first point, I think that the CDK4/6 inhibitors, they lower your white blood count, but I would still use them. It's just you're going to need a lower dose.
Yeah, and he said that, Lindy, when we met with him, Dr. Melbed, remember he said we're going to start low and go easy. So I think talking to him, right. I think he's aware of everything. He's excellent. I think
Okay, so it could be, I don't know how to investigate supplements and evaluate which ones might be causing low blood cell count. So,
Right. Okay. Well, you said that your white blood cell count was low a year ago, right? It'd be good digging up those labs, okay, to start. Second, we can go through some of these things that you're on to see if you've been on them for a week or for a year. Okay, so this is, I don't know a lot of the things that you're on. This Zyme Essence, how long have you been taking that?
I think I started taking that one. I'd have to investigate.
We're Dr. Silva.
And
We're
then
gonna
probably back in September-ish.
Okay. Cindy, go ahead.
After this, Lindy and I are going to meet with our naturopath. She's brilliant. She's got several doctorates and stuff like that. And I think between her and I, we can tackle that and kind of dig into that and see if we can figure it out.
Because it's really important to find out. Because if any of these are associated with a low white blood count, we need to eliminate it. Because I don't know any of this. I don't know any of these. And, so I don't know this seismic 6. I don't know olive leaf extract. I don't know if that's just olive oil. If that's just olive oil, then you should take olive oil. Okay? The cod liver oil, I love it. The magnesium glycinate, I love. And the vitamin D. None of those should cause your white blood cell to go down. Now, there's one here called Hercules spray. I don't know what that is, but it's 3 times a day. So these are things that need to be investigated because it's not, I'm a hematologist. Anytime somebody would come in with a low white blood count, 99% of the time was, open your pantry. What are you taking? The answer was there. So I would have to guess that one of these things is what's causing their low white blood count. Okay? Now, I don't know what CDG estrodim is. I want to know what that is.
It helps her metabolize and get estrogen down. She was just started on that. I think it's been, was it a month ago, Lindy? I think that's it's to try to help metabolize and get estrogen out is what that one is. That was a naturopath that put her on that one.
I just want to make sure because sometimes they contain estrogen and that will be gasoline on the fire.
Yeah. No, I went through all her stuff and made sure even like yucca plant, anything that might have, like Cellucor has yucca plant in it. That's why I don't like to use Cellucor.
Okay, all right. So I just need to make sure that didn't have any estrogen because I saw a guy like 2 days ago with prostate cancer. He went to his naturopath with a lot of degrees that put him on testosterone, and 2 years later, now it's in his bones. Okay, so
yeah,
we just need to make sure that it doesn't have estrogen, and you don't want testosterone because testosterone becomes estrogen.
Mm-hmm.
Okay, great. Okay, so far, any questions? Okay, so your CRP is 6.2, so there's a certain level of inflammation going on in the body. Your CEA was elevated at 166, so that's something we'll be able to follow. There'll be a number to follow, and I'm sure that'll drop. Your hemoglobin A1C was 5.5, which is surprising to me because you weigh 119 pounds and you're a thin lady. You should be around 5.0, not 5.5. So something is affecting this, and I think you may have some gastrointestinal issues that you may not even know about that you may need to be on microbiome therapy, okay? Which also resolves migraines. And I saw it's one of the problems of having the toxic bacteria is migraines. Okay, so far, my dear Lindy, I agree with the medical oncologist's advice in taking the three things, okay? Okay. And I don't want to just move on from this point. I want to be clear about it because you're at a point that is very important to make the right decision, because the wrong decision, will lead to your death promptly. I'm not being bad. I'm telling you the truth because that's what I do. I tell the truth. Okay? Just like I told you that I'm hopeful that if you do the right thing, you can live for many, many years. Okay? But somehow I feel hesitation, and that's why I want to be real clear.
Lindy, how are you feeling?
Yeah, this is important.
Okay, I think you asked me or you said that I'm going to need to be on the three things. So I guess I'm waiting for you to explain what that means. Did I miss something?
The aromatase inhibitor, the CDK4/6 inhibitor, and the Zometa.
Okay. I'm sorry, I got lost. Okay, so those are the three things that
he recommended.
That the oncologist is recommending. And yes, if you're both, if everybody's in agreement, that's what I need. That's what I'm going to do for sure.
Okay, great. I think someone is trying to come into the chat. Wait.
Yeah, I think we lost Michaela.
Oh, okay. I just let her in again. Yeah, there you go.
Okay.
Okay.
Do you have a question, Jot?
No, I think Dr. Silva, one of his major... Dr. Silva, I'm her husband, Jot.
Hey, Jot, how you doing? Great to see you.
Good, thank you, sir. I think one of your main points is let's be really careful about these supplements. Is that right?
Yeah, I'm careful about the supplements and careful about not going down the wrong path. Because there's two paths here, okay? There's the traditional path that is just traditional and crazy because it doesn't pay attention to anything else. And there's the natural path that is also crazy because they ignore some good scientific evidence. And then there's the middle of the path where you take the best of traditional and the best of naturopath and you use it on yourself for the best possible result. And we treat you as an individual, one person, okay, who you are, not just numbers and things. So I think we need to take a little bit from both worlds. I'm sorry, I'm screaming over that noise. Can you get yeah. Listen, I have been without a voice for 8 days. That's why I'm using this, okay? And now I find myself screaming, so I'm gonna lose my voice anyways. Okay, so whenever you need to talk, we turn it on and then we turn it off. So John, yes, and I also think that about 15 years ago, already 15, say by the year 2010, 2015, women who presented with stage 4 disease, like Lindy, had, some of them had a very good prognosis to live more than 10 years. That was 15 years ago, okay? So we can't ignore that, okay? That with traditional medicine, women were living 10 years with stage 4 disease 15 years ago. And now we have new things. So there's no reason why to ignore all of that. Okay, you have any questions, Michaela?
Sorry, I got lost there.
That's okay.
So
you're back.
So is the goal to cure or slow the progression?
The goal is to keep her alive with great quality of life.
with the
stage 4 metastatic breast cancer is not notorious for being curable.
Okay. So we're aiming at quality of life then.
And progression.
Okay.
Both.
but we're not
Both.
going to rule out total cure. We're gonna pray for that.
Well, the Lord is always in charge,
Yeah.
so nobody's ruling out, miracles. I'm all for that, or, and we're gonna do a lot more things. Like, for instance, we're gonna get into the ivermectin, the mebendazole, the chlorine dioxide, all those things that weren't around many years ago that potentiate the benefits of what you're taking, or what you are going to take.
Dr. Silva, Michaela's a nurse.
Great. Hi, Michaela. I should have figured you were a nurse. I should have figured you were a nurse by the color of your hair. Oh, what? You thought I was going to let that alone? Well, you can come back and say, at least I have hair,
I have a question.
And these,
Yes.
Kayla, you want to go ahead first?
sure. I don't know if y'all already talked about it, but I was wondering about the medications, if they're going to be making her feel sick or.
We'll take it one day at a time. We'll see. I talked about the aromatase inhibitors, how they can affect the joints of some people and cause joint aches, okay? Some people cannot tolerate them. Some people can. And sometimes as time goes on, you get better with them, more used to them, and there's no problem. I had some patients on aromatase inhibitor 10 years, and they tolerated it fine. Some women could not tolerate the aromatase inhibitors. But when they developed metastatic disease, they took them and they tolerated them just fine. Okay? So my point is, they were feeling at the beginning what they were reading about. Because later on, they took them and they didn't feel it anymore because they wanted to live. Okay? So it's not about talking yourself into feeling whatever you're supposed to feel, because you may not have side effects. Now, if you have side effects, the dose has to be dropped. The medicine can be switched for another aromatase inhibitor, and eventually it can be changed for tamoxifen. Okay, along with the CDK4/6 inhibitors. And the main side effect of the CDK4/6 is some can give you diarrhea, and some can give you a low white blood count. Those are the main side effects to worry about, okay? The zoledronic acid, the Zometa that you give every 3 months, the day that you get it can give you fever and joint aches, and then it goes away. You want to make sure that before you start getting the Zometa, you get your mouth in good shape. Go to the dentist. Cindy, help me out if I'm not explaining myself well.
It's good. Yeah.
Okay. Okay. Michaela, next. Next question.
That's it at the moment. Go ahead, Mom.
Okay, so it sounds like to me that oh my goodness, hormone blockers are to improve the tumor, maybe shrink, maybe even release where the skin is messed up. And then the IV once every 3 months is to strengthen the bones. What is going after the cancer? And then I had another question about the gut.
The aromatase inhibitor is going after the gut cancer.
Okay, so that's not just slowing, it's actually trying to defeat the cancer.
Yeah, but it's shrinking it, right? And it's doing the same in the bone. Whatever's doing in the breast is doing it in the bone also.
Okay, so these 3 drugs are cancer fighting drugs. They are trying to kill, defeat, remove.
Exactly. Like the Someta, one of the things that it does is it prevents metastases from growing in the bone. It makes it more hostile for the metastases to land, to be able to land and grow in the bone.
Okay, because I was just wondering what we are going to do to try to kill the cancer, to defeat it, get rid of it, if that's within.
Yeah. And Lindy, he's just start with the cancer treatment, but everything else that he's going to introduce here in a little bit is like barring the door, all different. It's like you have lots of doors. He's going to bar the doors several different ways. So we're going to come in at it from all different directions. But he's getting ready to go into that.
Okay, and my second question was something you talked about, the gut. I have had migraine issues. So you're saying there was something specific happening in my gut that could be behind the migraines. Could you repeat what that was in my gut that was of concern?
Well, we'll get to that later. I mean, I haven't even begun my consult. We just been talking about what the other medical oncologist said. Okay? Which is part of the consult, because it's very important to do the right stuff. So I just wanted to start it. I wanted to start on solid ground. I wanted to, because then he said, and the other guy said, no, I want to bring it all together and be very clear. That's why I haven't started with ivermectin, okay, which is fantastic and you're going to love it. Okay, I haven't started with that, but because I wanted to first go through what you already know and what you should already do that I agree with. Okay? Okay. All right. So
everything the doctor said, you support and you say yes.
Yes, I support everything the doctor said. Cindy, help me out here.
Yep,
okay,
you're good.
Okay. Okay, yes. Okay. Now, just one question. Did, what was his name? Dr. Moma or something like that?
Melmed. He's great.
Mohamed.
Yep.
Okay. Now, did he mention chemotherapy at all? Just wondering. Okay. So,
he said later on down the road there might be an opportunity for that, but he wants to.
Sure.
Yeah.
Okay. All right. Okay. So, I think.
Go ahead. Try again.
Hey, Dr. Silva.
Yes, sir.
I'm sorry. So her HER2 count, is that what you call it? Or HER2 count?
Yes, sir.
Low or negative, as you would say. Is that one of the reasons why the chemo has not been suggested?
No, because sometimes you can give the HER2 agents like Herceptin, okay, or trastuzumab, the other name for it. Sometimes you can give it with hormonal therapy. You usually give it with chemotherapy, but if she would have been HER2 positive, he would have definitely offered chemotherapy. I would have offered chemotherapy up front. Okay, the HER2 tumors are more aggressive. Okay. Okay, now, so I agree with the vitamin D and the magnesium that you're taking, okay? The super sauna, I'm sorry, I see you're doing the sauna, correct? Okay. How many times a day or how many times a week?
I try to get into the sauna and I'm pretty successful just about every day.
Great. Denton, is that close to Dallas? Not even close, right?
It's within an hour.
Okay. So, Cindy, I think she would be great to for the super sauna machine. If she could do like one day out of the week.
Yeah. So she has her own at home, but it's of course it's not like the super sauna. But if we, Lindy, if we can try to get in like once a week at least to Grave Care to do the super sauna, while you continue on the other days your other one.
Yeah, because of the red light and the blue light, all the different frequencies, I think is great. And then if Priscilla were to get the hydrogen machine, that would be great to decrease inflammation at the breast and wherever there's cancer. So the hydrogen machine would be great at the. Ask Priscilla about it to see if she gets it. Just keep pushing. Okay. The vitamin D, the magnesium, okay, are great. Now, are you getting to do some grounding?
Yes, I'm not super disciplined, but I believe it happens just in my day. I love to go outside. I've been, since I've been at my daughter's house, I've been going outside in the sunshine twice a day. So that's,
right.
Yeah.
But grounding, I mean, bare feet on the grass or the beach?
Yeah, that when I go outside, I'll put my bare feet on the grass.
Great. Okay. So ideally it would be 30 minutes a day. Okay. And ideally, you will not use the microwave, correct? You don't use the microwave.
No, I don't use.
Okay. And you have it disconnected at home.
We threw it away.
Fantastic. So did I. I love it. Okay. And the router, do you disconnect it at night?
We do not.
Okay. So it's great if you can actually just, at night, you just hit the button and in the morning you hit it again, but that way you're not getting radiated for those 8 hours. Sorry, I shrank this. Okay, and the cell phone outside the room on airplane mode. Okay, now I think I'll come back to these two. I think let's talk about ivermectin. Okay. How many? You weigh about 50 kilos, correct?
I think I'm at 119 right now.
Yeah. Yeah, that's 54 kilos. So I'm going to shoot for 50 kilos, okay? And you're going to start, each tablet is going to be 13.5 milligrams of ivermectin. So week 1.
She's up to, did we figure out how, I think she's up to 50 already.
I didn't see that on the note. I'm sorry.
I'm sorry.
It's okay.
I was trying to find my cheat sheet because she takes the liquid and I got a cheat sheet for the liquid and I can't find my cheat sheet on the liquid. But I think when I figured it, you're up to the recommended dose. Didn't we figure, Lindy? Yeah.
So she's on 50 milligrams already?
I'm pretty sure. Yeah, I'm pretty sure. When I double checked it, but like I said, I can't find my cheat sheet for the liquid.
Great.
Yeah, so Cindy had me work up from low to full high, and I've been taking that every day, both that and fenbendazole up to the same maximum.
I think the fenbendazole, what are we up to? Do we get up to 1,000 or 800?
800, I believe.
Okay, yeah.
And you're doing that every day? Beautiful, okay? So fenbendazole, you're taking 888 milligrams every day, okay? And the ivermectin is with food. The fenbendazole is with olive oil.
I take a spoon of olive oil with each of them, not with food.
Okay, the ivermectin should be with food. Okay. And the fenbendazole, to the food you can put the olive oil. I think you can do as much olive oil as you want, you know, as long as it's good olive oil. Okay, so you're up to speed on that. That has to be from a single source and all of that. Cindy, she's got does she have the right olive oil?
Yeah, I think we talked about it. We'll double check. Yeah, we'll double check. We'll make sure.
Okay.
Olive oil that for her that is very high in polyphenols.
Okay, but the olive oil?
Yeah.
Yeah, but my question is it is it a single location olive oil, single source? You know,
That island way on the other side of the Morocco, I think.
okay, no, Morocco is great. I just don't want it to be Morocco and Algiers. When it's more than one location, they mix in vegetable oil. So that's all. Moroccan olive oil is great. I love it. Lebanese olive oil is great. It's just, I just don't want it to be Morocco and Lebanon. Single source in a glass bottle, always. No plastic.
10. I ordered a big batch.
Beautiful. Okay, tin is fine, but no plastic. Beautiful. Okay. All right. Yeah. Okay. I think. And how long have you doing the ivermectin fenbendazole for, Lindy? How long have you been doing it?
I went to the beach in February, so since the end of February, I started taking it with my ivermectin and fenbendazole daily.
Okay.
Yeah.
So
You just started the daily for, I think you've been on that because I had her on the alternating until
Hey, you moved her.
Yeah, once we found out the results of the pathology and everything, we went to daily.
Good. And so she's been on it what, 2 weeks, 3 weeks, the daily?
2 weeks, I
A month.
think.
Okay.
I think 2 weeks.
All right. And have you noticed any difference in the breast?
Well, yeah. I had the biopsy as soon as I got back, and then I had all the pain and
that set her back. That set her back.
Sure.
Yeah.
Sure. Okay. And I think we should add the mebendazole.
Yeah.
And I would start with 250 a day. For 1 week. And then go up to 2 tabs for 2 weeks. And then 3 tabs every day. What do you think about that, Cindy? Okay. Because some breast cancers are more sensitive to mebendazole than to fenbendazole. And some are more sensitive to fenbendazole, so we don't know. So to maximize our odds, now, all these medicines have many different mechanisms of action to fight cancer. Okay. For instance, ivermectin helps to to get to the cancer stem cell. Okay. It also shuts down pathways, okay, special pathways that make cancer grow. The fenbendazole and the mebendazole, they shut down sugar into the cancer. They block the glutamine going into the cancer. They also have the benefit of increasing tumor suppressor genes like P53. You know, these are tumor suppressor genes that produce a tumor suppressor protein that is just that. It's a protein that suppresses cancer. So mebendazole and fenbendazole are increasing these. Okay. All right. So far, any questions? Okay.
Okay.
No, I think you're going to help me understand the connection between or explain what's going on in my gut and the migraine later on, you said.
Yeah, I'm not there yet. Okay. I just wanted to go over these medicines because these medicines are going to complement the others. Okay. Now, it's important for you not to tell Dr. Maomad, I can't get his name right.
I
but,
know, it's weird. Med.
Wait, Mahomed, like Mohammed with an A?
No, it's MELMED, like medication. Melmed.
Oh, Mahomed. Oh, okay, like
Yeah.
Mahomed. Okay,
No.
thank you.
So he's told some of my clients that he likes ivermectin, but we don't talk about it though, just in case. So
I would not mention ivermectin, mebendazole, and the other stuff that you already mentioned. Whatever Hercules and the CDG estrodim and the seismic 6 and all those things. I guess they're okay because they're not political. But unfortunately, the other three became political because they really work. Okay, so you don't want to mention it, and you don't want to think that the nurse or the nurse practitioner is your best friend, because she will tell the doctor. Okay, because she works for the doctor. He is her boss, and it's her duty to tell her, hey, this patient is taking ivermectin. Okay? All right. Okay, so far, any questions? Michaela? No. Okay, next. Okay.
I don't know, Dr. Silva. I think my other daughter may be online. Is Mallory with us? If she has questions.
No, I don't have any.
Stop it just for a second.
The moment she pops up, I'll admit her, but I haven't seen a request.
She was worried that maybe the noise was caused by her.
Oh, okay. Tell her to come back on. That we know who's making the noise. Tell her we got it all figured out.
I think it's my old computer, Kayla. I'm staying on mute.
Yeah. Okay. So, as soon as I see her name pop up, I'll let her in. So don't worry, okay? Okay. So, do you have a water purification system? Good. Yes. Okay. I like reverse osmosis. That's my favorite. Okay. Now, and do you have a good salt that doesn't have microplastics?
Cindy, I think Cindy's advising me. I'm on a what is it called the kind of machine that I'm on as far as water? I'm taking Himalayan pink salt and I'm doing distilled water.
Okay. I think that's fine. Just make sure that the Himalayan pink salt comes from Pakistan, because China is doing half of them and they're full of microplastics. Okay.
What about Celtic?
Celtic is okay. My favorite is Baja Gold sea salt. Celtic, they're having a lot of lawsuits now because they're finding that the Celtic salt, which I recommended for years, is one that has heavy metals in it that they never disclosed. We'll see. Okay, and to fry, you should only fry it with like coconut oil, butter, beef tallow.
How is palm oil?
It's a no. That's negativo. Negativo.
What about the iodized salt? Does she need iodine?
She does need iodine, and we're going to get to that. And that, well, I'll just mention it right now. She can get detoxidine and from Global Health.
Yeah, from Global Healing.
Healing. Thank you. Global Healing. And use three to 4 drops a day.
That'll help your mold too.
Yeah. And also the turmeric from them. And the mushrooms from them, I think that would be great. The mushroom powder.
Even though I have mold issue,
Why would it be a problem? I don't get it.
mushrooms are mold.
Yeah, but these mushrooms build your immune system. They're not the toxic ones. You're not breathing them in. Okay.
Do you want two full droppers, morning and evening? Or?
I think we would start with that, but the goal, it could be like 3 droppers a day, because that really boosts your immune system to fight the interleukin 6 that's causing all the inflammation. So we can start with 2 droppers a day.
Morning and evening?
Yeah.
Okay.
Morning. You put them on a spoon, and then you take the spoon. And when you put the dropper on the spoon, you can put the 3 or 4 drops of iodine on it and take it. But the iodine is only going to be once a day. Oh, we got Mallory going on.
So, Cindy, are you going to work with me on supplements? I'm getting a little lost.
No worries. I told you, don't worry about it. I got you.
Yeah. No. Cindy's got you covered like a blanket. Okay? All right. Now, let's talk about the microbiome. Mallory, I don't see you. And listen, you were making a lot of noise before. You're back now. You don't have to be silent. Okay? You can say hello. And you can show your face. We still love you. Okay?
Thank you.
All right. I'm looking for my cheat sheet. Okay. So what happens is that as a nation, okay, as Earth, because it happened everywhere, but it didn't happen in Europe like it happened in the United States. And the United States has been the worst attack on the intestinal system that we have. Okay, so your intestines are supposed to defend you. Well, I just had a thought. Well, the other thing that this guy, the Dr. Malmed, said was that he wanted to do genetic testing and next generation sequencing, which I really like. I think genetic testing is great to see if you have a BRCA1 or 2 mutation, that kind of thing. And the other opens the avenue for treatments like with pembrolizumab. So I tell you, he did a real good job, you know?
Yeah. Yeah.
Right.
He's on it.
Next. So what happens is that your intestines have been destroyed, okay? And 70% of your immune system is in your intestines. So you need to rebuild your intestines. How do you rebuild your intestines? This is not only for you, this is for all of us. I mean, this is what I do and I give to my kids every day. Okay. The Lord made us with certain probiotics in the gut that help us fight cancer by building our immune system, that help us fight depression, anxiety. All of that is really a manifestation of a toxic, inflamed gut. That's all it is. Okay? If you want to read more about this, I'll recommend you this book. It's called The Super Gut by Dr. William Davis. He's a cardiologist. He's got more than 200 YouTube interviews. And he's really like a pioneer. He's been ahead for a long time. So these probiotics are very important because they help you make things like serotonin, dopamine, GABA, oxytocin, all kinds of hormones. For instance, most people that you know in the US are taking a pill called an SSRI, okay, because they have depression or anxiety, okay, and that those SSRIs that half of the population is on really don't work, because if they would work, the suicide rates wouldn't be going up. Okay. Second, these are pills that were tested for only 3 months and people are on it for 20 years. They have a lot of side effects, like changing your brain structurally and making you completely dependent on these pills. So what happens if you put something called lactobacillus reuteri in the right amounts? Because if you take a pill, you did nothing. You need to take like 300 billion colony-forming units. So if you put reuteri in your intestine, okay, it starts producing something called serotonin. So anxiety, depression disappear. You make oxytocin. Oxytocin leads to the production of collagen that strengthens your bones. Okay? And there's a lot of benefits to that. Also, it builds your immune system in your intestine. So when all these good gut bacteria die, okay, and how did they die? They died because there was glyphosate in the food. They died because we were eating canola, mazola, and yo mama oil, okay? So all of that was disgusting, and we ate it for a long time. There was a time that margarine was the only thing to eat because it was heart healthy, okay? Margarine is one step away removed, chemically speaking, from plastic, okay? So we destroyed our intestine with antibiotics. How many people took antibiotics for whatever? Just take a Z-Pack, Okay, so the average American, by the time they're 40, has taken 30 different courses of antibiotics, okay? So your intestines are gone, okay? How many kids with just ear infections take antibiotics? Okay, so the first probiotic that you need to take, that you're going to get in a fermented form of 36 hours, you're going to order it from a lady. It's the only lady I know that makes it in the United States. No one else makes it, okay? And it takes 36 hours to make, because when you ferment it for 36 hours, the lactose disappears, becomes lactic acid. So there's no more lactose, okay? But with 36 hours of fermentation, you get 300 billion colony-forming units every spoonful. This is what you need. Not the tablet that has, 300 or 400 million. This is 300 billion, okay? So that's the number one. The second one you're going to take is called Infantis, okay? This one helps structurally the brain. The mothers that breastfeed and have Infantis, of course, 96% of American women no longer have it, but the women that have these and breastfeed their children have a much higher IQ, they don't develop diabetes, and they don't develop asthma, okay? The next three is to kill something called SIBO and SIFO, okay? Okay, SIBO and SIFO. Is small intestinal bacterial overgrowth and small intestinal fungal overgrowth. They go together. And what happens is that when all your good bacteria have been killed by antibiotics, glyphosate, ibuprofen, omeprazole, and all the other things that we see in the air that they're spraying us with that is beautiful because it has aluminum, okay? When that happens, the bacteria in the colon starts climbing up because the good ones are no longer there. So there's no longer an equilibrium. And you develop something called dysbiosis or no equilibrium. So they come up, and what happens with these toxic fecal bacteria like E. coli, Salmonella, Shigella, Campylobacter? They cross the lining of the small intestine, okay, and they get into your bloodstream, releasing endotoxins that lead to inflammation and immune suppression. Does any of this make sense to you, Michaela? I sure hope so. How about you? Come on. Is it making any sense? Not really. Okay. All right. John wanted to say something. Let the poor guy talk. Come on. He hasn't had a word in a long time.
Yeah. So about the biome stuff, Lindy's really studied on that and whatnot. So what you are saying does make sense, and it does ring true to us.
Okay, I love it. John, you like how I gave you a spot to talk, man, because growing up with 2 daughters and a wife, I have a friend just like you. He sits at the table, they ask a question, and when he's getting to respond, they already changed the topic 3 times. Okay, it's like, he tells me, I don't know when to answer because the topic already changed. They're so fast, that I just can't keep up. So anyway, I was picking on you. All right. Next. So infantis is the next one. Okay. And infantis is very important because it works. Now, the next 3 kill the intestinal bacteria, and they're called Gasseri, Lactobacillus gasseri, Subtilis, and B. coagulans. These 3 are fantastic in killing the intestinal infections. So your intestine can go back to being normal. Okay. The
One
next
more
2.
time.
What?
Could you say those 3 one more time?
Yeah. Gasseri, which is Gasseri. Subtilis, Subtilis, and coagulans, coagulans. But Cindy's got you covered like a blanket. Don't worry. Okay.
I'll get off.
Those 3 are great in helping rebuild the mucus lining of the intestine. Then come crispatus and kasei shirota. Shirota decreases your cortisol levels, so it helps bring down the sugar. And crispatus is great not only for the skin, but it's called a vaginal and prostate probiotic. Because some women, when they go through menopause, they develop a urogenital syndrome that they get urinary tract infections every 6 weeks. Okay? How do they treat them? Antibiotic. What happens? The GI flora is gone, so it's a never-ending cycle. Crispatus lowers the vaginal pH to 3.5. Infections are gone. In premenopausal women, it decreases the loss, a miscarriage of a baby by 1/3. 33% less losses of babies. Okay, so crispatus is all around fantastic. It's also great for the prostate. Okay, now, and the last one, kasei shirota, is very important because it helps bring down the cortisol levels. The next one is called kefir. In Texas, they call it kefir, but you should get the one from Koren or make it at home as long as it's not pasteurized. Because if it's pasteurized, you're lost. Okay? And now, I'm going to tell you how to take these, but before getting to that, there's several things that you need to eat every day. You need to drink bone broth that is not pasteurized, that like Koren has it, that comes from cows that eat grass that doesn't have pesticides. Bone broth and sauerkraut. Because sauerkraut that is not pasteurized, not the one from Whole Foods, it needs to be not pasteurized. That sauerkraut, along with the bone broth, line the intestines. And when that happens, guess what happens? There's a bacteria called Akkermansia, Akkermansia. Akkermansia has got one specialty: to fight cancer. You don't have it in your gut. You need to get it. I don't have it. I need to get it. We need to all get it back. We need Akkermansia in our gut to fight cancer. Okay? No medical oncologist is going to talk to you about that. I'm a medical oncologist. I know. Okay? I mean, I was a professor at the university for 15 years, and the lecture was always the same. 70% of your immune system is in your gut. The lecture ended there. Okay? We need to do something about it. Okay. Now, what else can we do about it? You need to eat food, 2 specific foods that is going to nurture the probiotic. These are called prebiotics. The prebiotic feeds the probiotics. For them, for these 8, and the kefir is important because it helps the other 7 multiply. So when you put all this together, it's really fantastic. Okay? And especially the Ruteri is great for making migraines go away. Okay? So you're going to do the green banana. You need a green banana every day. That's the one that the skin is green and is very difficult to peel, that the skin is really stuck. Why? Because it has a resistant starch that lowers your sugar, and it's full of prebiotics that feeds these fermented medicines that you're going to take that look like yogurt and taste like yogurt. And they're not yogurt. I want to make this clear because it's not yogurt. I had a patient that told me after a long conversation like this, 6 weeks later, doctor, I don't want to take yogurt. I mean, it's just yogurt. What can I buy? And I said, did we really have a 1-hour conversation and that's all you took away from it? It's not yogurt. These are fermented medicines. Okay? Michaela, can you explain that to Mallory? I'm just kidding. We gotta laugh sometime, right?
Yeah.
Okay. Okay. So the other thing is that I would like for you to have 1 ounce. 1 ounce. I know you're thinking alcohol. I'm not going there. 1 ounce of cacao, of 100% cacao every day. Cacao is very anti-inflammatory. It's full of magnesium. It is the strongest prebiotic to feed the good probiotics. Now, when you start on this microbiome therapy, which I'm not done with yet, you may have some side effects. Because imagine, you're killing all these bacteria and they're going to release things into the bloodstream. You can get a rash. You can get a headache. You can get you can get diarrhea. It's not a painful diarrhea. You're just flushing out all this bacteria. Okay. So far, so good. Next step, and this one is really, really important. And then I'll tell you how to take these, okay? So what you need to do is, you're probably doing it, you need to floss every day followed by the water pick. Because flossing moves the particle, the water pick gets it out. Then it's going to leave the spaces in the gums open. And you're going to do coconut oil pulling. Coconut oil with organic coconut oil, extra virgin, cold press, in a glass, just like the olive oil. You want to do that for 10 minutes a day. 7 to 10 minutes. Coconut oil pulling. I just want to be clear on this because a lot of people think it's cheek to cheek. That's not coconut oil pulling. That's coconut oil cheek to cheek. Okay. Coconut oil pulling, it's like when you take a lemon after a tequila shot and you suck the juice out of that lemon. Here, you're going to do the same. I know you've never had a tequila shot, but I have. And so, I use that as a good example. Michaela, I know you. And Mallory, never. Okay. All right. But I went to college, guys. That's all. We all make mistakes. All right. So, so you're going to take the coconut oil, put it in your mouth, and you're going to back like this because you want to push it into the gums. Why do you want to do this? Okay. The reason is that there is a bacteria in your gums called Fucibacteria. Fucibacteria is an anaerobic bacteria that when it gets into the bloodstream goes for an anaerobic environment. And where is that? In the cancer. So it feeds the cancer. So the microbiome begins in the mouth And we need to kill the fucibacterium in the gums. Okay. How are we doing?
I tend to have nasal issues, and oil pulling can be almost impossible if I can't breathe through my nose.
Okay. Well, just do
But
the best you can. Do
yeah.
the best you can.
Sometimes I can breathe partially through one nostril.
Well, but oil pulling doesn't mean that you can't open your mouth. I mean, I do it every day. You can't breathe, you open your mouth, you breathe, and then you go back to oil pulling. God, help me out.
Or with your mouth.
Yeah, you know? Oh, big point. Big point. When you finish with the oil pulling, you cannot spit it out into any tubing. You can't spit it out to the sink. You can't spit it out into the toilet. It'll clog all tubing. You need to spit it out in the garbage. Or like, you know, inside one of the parts of the sofa if you don't like the people that you're visiting. Okay. All right. Next. I love this to lower your sugar. And I want to lower your sugar. It's called berberine. Berberine. And it's great to get rid of fungus in the intestine. Berberine twice a day, 2 times a day. Now, how are you going to take the microbiome stuff? You're going to start with, I want you to start slow because since you've had mold exposure and migraines, I think people that have SIBO sometimes are fat, but sometimes the skinny people have the worst SIBO. They got the worst bloating and migraines and this. So you're going to take a tablespoon, like a soup spoon, and you're going to take a quarter of a tablespoon of all 8. Mix it in a bowl and just take it like yogurt, although it's not yogurt. I need to keep making that point because people get lost. I'm sorry. It's crazy. Okay, so when you take it, I don't want you to put anything in it. No blueberries, no strawberries, no honey, nothing. Okay? Because half of the honey that you get comes from fructose, the one from Whole Foods. Okay? And the other blueberries they have been sprayed with glyphosate. So imagine you take these probiotics that are a treasure, and now you put glyphosate in them, and you kill them. And that's what you're going to eat. You're going to take it by itself, nothing more. Okay? Jot, you too. You fight for that spot at the table.
All right, yeah. Yeah, so we're pretty much all organics, so I guess we're okay in that department.
No organic blueberries on the yogurt. None. 0. You just eat it straight up. And organic it's full of pesticides also.
Huh.
So are you talking about the SIBO yogurt now, or are you talking about the supplements that are not yogurt?
I'm really lost.
Because I don't know, you gave Jot a list, or Jot's writing down a list of things to take, and you keep saying it's not yogurt.
Right, yeah.
It's a fermented medicine over 36 hours. Those are not tablets to take. I'm taking the elements. I'm telling you the elements of the fermented foods. If you take that in a tablet, you're doing nothing.
So, Lindy, yogurt has lactic acid in it, but these cultures remove that, and so it starts out as yogurt and turns into a medicinal culture. So that's why he tries to educate people that it's not really yogurt. It transforms into just a regular culture. That's what he's getting at.
No, regular yogurt has lactose. This
Lactose.
medicinal products do not have lactose. That's why people that are lactose intolerant can take it without any problem.
So Cindy, do I understand I'll be taking the SIBO yogurt and this particular culture?
Forget about the SIBO yogurt. You're going to be taking 8 different ferments. 8.
There,
Call it whatever you want.
yeah. The SIBO yogurt is part of it, but it's put together to make a new one that he suggests that fights all of them. So what I gave you has probably just 3, but you need all of them. But I'll bring you one just to get another one to get you by, because corn is not available right now.
Right.
For a little bit.
So the 6.
Till it's 6.
And the lady that makes it is Corinne Feinstedt. Okay? So when you call her, you're going to need to tell her what you're taking. But I'm going to leave her a message right now with your name and the things that you need to take. So when you call her, you say, I'm Dr. Silva's patient, because otherwise she won't, if you just call her randomly, she's not going to do it for you. Okay. All right. So, how are we doing?
I'm doing great. How are you doing, Lindy?
It's overwhelming, Lindy, but it's fine. I told you it's going to be fine. We'll work through it. Yeah.
Yeah. I think there's a couple of other things that I would like to say. I know it's overwhelming, but I think it'd be great if you take fish oils that are omega-3, like the super EPA, because they're very anti-inflammatory. They lower the risk of blood clot, and your D-dimer was 0.87. You see, Cindy, I do look at everything.
Yeah.
You see? I wasn't leaving that out, you know? Okay, so the CoQ10, I recommend the CoQ10, the Super EPA. Those two, the Super EPA is 3 tablets a day of omega-3s, and the CoQ10 is 2 tablets, 1 in the morning, 1 at night. And the last thing I would do to get heavy metals out, especially like mold and things like that, would be spirulina. Spirulina, 6 tablets a day from micronutrients. Okay, I'm gonna be quiet for a while and take questions. In the house.
I was wondering, you said even the organic foods have a bunch of pesticides, so are they really much better than inorganic foods?
Yes, they're much better, a lot better. However, you still have to wash them properly to get all the crap out of it. How do you wash them? 1, you take them, you put them, just like your veggies, in reverse osmosis water or a good filtered water, okay? Then you add sodium bicarb to it. Cindy, what's the other word for sodium bicarb?
Baking soda.
Baking soda. Thank you. You add baking soda to it, okay? And I even put a little bit of salt, okay? Of the Baja Gold sea salt, okay? And then you move them around for 5 minutes, and you drain that water, you wash it, and you clean it out. Then you fill it up with water again, and then you add apple cider vinegar to it. Now, we didn't even get to that today, because the list goes on, okay? But apple cider vinegar will also help you lower your sugar, okay? So, you put 2 or 3 capfuls of the apple cider vinegar in the next set of waters, and you wash it for 5 minutes, and then you wash it again after 5 minutes. So it takes 10 minutes, at least 10 minutes, to wash the organic fruits and vegetables, at least, and then you can eat them. But you need to get the pesticides, herbicides, all the crap that they're spraying on it off of it.
Wow. Okay, thank you.
Yes. Like bananas, you don't need to get organic because they have a cover on it, you know, things like that. Let me tell the apple cider vinegar cannot be Bragg's. That's the only one that you can't get. The apple cider vinegar, because that's owned by Bill Gates. Okay? So you need to get the apple cider vinegar that's in a glass bottle that is raw, unfiltered, and with mother. And you know what, Lindy, you can do a couple of capfuls. Like in the morning, you get up, you can do a capful of the apple cider vinegar, the good one. But you need to use a straw because it stains your teeth. Okay? And you can do one before going to bed also. That way, it helps lower the sugar throughout the night. I don't want you to lose weight. I just want your metabolism to work better so the sugar runs lower. But my intention is for you not to lose weight. Okay? Okay. Questions?
I found that after I saw the oncologist last week, and he gave me ideas on what he recommends, that was Thursday. I started a fast, and I did a 3-day fast, Friday, Saturday, Sunday, which I don't usually fast, but I had it on my mind to fast when I was at the beach in January, or I forget the month, February, and just didn't know how to do so. And I got some instructions from my son-in-law who understands these things better, and gave me some ideas on how to do it. Anyway, huge success. I feel like it just took the sharp pain away almost immediately. And I was having to be on pain medicine around the clock. And I'm thinking that I would like to continue, but I would welcome your thoughts. I'm thinking 3-day fast once a month, and then maybe a 24-hour fast once a week. I was very, very pleased with the results, and I was starting to feel better and better afterwards.
I think it's a brilliant idea. I love it. Okay. I just don't know what you mean by a fast. What does that mean?
Well, what I did, I'll just tell you what I did. I did lots of water. I drank, probably a cup of water, 8 ounces of water every 30 minutes to an hour. So went through a whole lot of water with some sea salt. And I took the ivermectin and fenbendazole, so I thought I would include any medications that I need, and then went through my supplement list, and took also the ones that didn't have calories, thinking that I do not want to give cancer any calories. I think that's it.
Okay. For the next fast, no pills. No pills.
Even though I'm doing lots of supplements, take a break from all the supplements.
100% guaranteed.
And what about the liquid ivermectin and powdered fenbendazole?
Those 3 days, everything's out. Nothing.
So just water and sea salt.
Do nothing. Okay. How did you last 3 days?
I felt good.
Okay.
Jot did it with you, right?
What?
Did Jot do it?
No, I think he joined the first day, and I had another friend join 2 days.
Okay. I think the first day is by far the hardest. If you get to go to bed without eating those 24 hours, and you go through the night, when you wake up, you're really fired up because now you've gone 38, 40 hours. You broke that 1 day thing. So getting to like that is very good. I think if you do 5 days would be even better.
That was kind of my goal. The 3 day was just to evaluate how I would feel, how I would do, and I thought next month I'm going to do the longer fast once a month. So I thought next time I would do a 4 day and the following a 5 day.
Okay. I think 5 days is the best because between 4 to 5 days, there's a massive release of stem cells from the bone marrow that go directly towards the damaged tissue. Okay. And so starting like day one, there's so much gut healing going on that's incredible. So I love the idea.
The water fast and the salt is a good idea. Is that
The salt is mandatory.
Okay.
Yeah. Especially if you're drinking distilled water, you're getting no minerals. So you need the minerals from the salt. You can even put a squeeze of lemon in there every once in a while if you want.
Okay.
Oh, that's what I was wondering. My son-in-law, who helped me lay this out and understand it, he has a product that he said is good for when you take fast. He called it electrolytes with no calories.
Yeah. I would just
Lemon?
You can get lemon and the salt.
So we aren't worried about losing too much weight during a 5 day fast?
No, because she's gonna go back to eating. I mean, Mallory, we're not talking about something over 10 years here. We're going month to month. If she lost too much weight with a 5 day fast, then next month she'll do a 2 day fast or no fast. Okay, I mean, we're gonna roll with the punches. We're gonna take 1 day at a time and see. But there's a guy in France that had a stage 4 lymphoma that did a 20-day fast and his lymphoma disappeared. And then he went back to regular life and it was a water fast. I don't know how he did it. God bless him. Okay, because I think fasting for more than 24 hours, you need like a special grace from God to do that. Okay, at least in my case. Okay, I've done 24, 30, 32, but man, then I wake up and I'm crawling the walls. But you know what? No, actually, when I wake up, I feel fine. It's later during the day that I kind of miss the habit of eating. It's not necessarily that I was starving, okay? But it's really, really healthy. And it also takes away any and all brain fog, like all the bad neurons that were intoxicated, you get rid of those, okay? So your brain starts just working on ketones and working much sharper, much, much sharper. No, I'm not worried about the weight.
Do you think the mold lowered her immune system to open her up for the cancer?
I think so, but she's got a very strong family history. So I think you may have a genetic predisposition, like a BRCA1 or a BRCA2, something like that. Because your grandmother died at 57 from breast cancer. I mean, that's nothing to ignore.
So, but we should find that out with your next visit with Dr. Melbed.
Exactly.
Yeah. Because I have some oncologists are like, what? I ask him about the next generation sequencing. They're like, we don't need to do that. But he's like, oh yeah, I don't know why they didn't do it. I'll make sure they got it done. So he's on it. I think when she went to the emergency room, I think her liver enzymes were a little bit elevated. AST 65, ALT 78. That was under the ED labs.
Yeah, I see it, 65 and 78. Okay, when we see each other again, we'll repeat labs. We'll see each other like in 6 or 8 weeks. We'll repeat labs. I'd love to see magnesium, CRP, the CEA, the A1C, and the CBC and CMP.
I wonder, her cholesterol being 203, you think that's inflammation, more inflammation than anything?
I think 203 is a beautiful number. I think it's completely perfect.
Okay.
I mean, they mark that because they have to, so they can put you on a statin.
Mm-hmm. The
203 is perfect. I mean, even 220. I mean, it's just you don't. I mean, I never worry about that. I just worry about the small particles.
Yeah. Okay. The Zometa, I think, with doing it every 3 months because she does have a lesion in her femur.
Yeah.
So,
I think
it's okay.
Yeah.
Okay.
No. Yeah, because that's where she weight bears, but she also has a lesion in her spine and sternum.
Yeah. But you think if they space out the Zometa, we'll still be okay?
Yeah.
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 Okay.
Every 3 months is good.
Okay.
For at least 4 times.
Okay.
And then if everything's coming down, there's no pain. The standard is to give it for 2 years. We can stop at 1 year.
Okay. Awesome. Lindy, I think we got a good plan for you.
Okay, Cindy, did you, I know you said that you were taking notes as we went along day by day, week by week. Have you covered all the questions that you and I discussed and that we had together?
I think so. Yep. I know where he lives, so too.
Yeah. Anything. She just sends me a message and I'll answer.
Okay,
No
and Mallory, did you have any questions?
No, I think that's good. Although the rinsing the organic vegetables after the first rinse and then the second rinse that has apple cider vinegar, do I do a third one that rinses the apple cider vinegar off?
Yes, madam. Yeah, you rinse that off too. Yeah, but remember, use like room temperature water. If you use hot water, it'll rip the skin off the fruits.
Thanks.
Room temp. Yeah, I made that mistake once. I mean, there were like no blueberries left after the hot water.
Kayla, did you have any like nursing medical concerns or questions about things we're doing or about to do, or general how I'm doing?
I guess I was a little bit worried about the bones also, because I have noticed just the tiniest limp the last couple times I saw her. Just the tiniest limp. And I know you said you're not really worried about her weight, but she visibly to me looks a lot skinnier.
Okay.
And I can see her trying to catch her balance too.
Okay.
Just when she walks.
So the weight and the balance and the limp are 2 different topics. I think that when someone has an advanced cancer, that they're malnourished, you can't do a fast. I think the only time for your mother to be able to do a fast is going to be now. And that's going to give it great benefits. We will not be able to do a fast if she gets more sick or thinner. We don't want that. So I think this is the time for a fast. 1, 2. If she has a limp and she's hurting because she's limping, then she needs a touch of radiation to that spot, wherever it is that is causing the pain. If she doesn't have pain, but if she's limping and she has pain, she needs a touch of radiation. They do that like in 3 days, and it destroys the limping. I mean, it kills that spot of cancer. If she has pain upon limping, and she's limping, then she needs radiation.
Does that make sense, Michaela?
Yeah. So are we gonna consider that or no?
I think she needs to get started with the oncologist. He's going to ease into everything. He's really good about that, and I think he's on top of that. That when he sees, he's going to evaluate her pain, what's going on. I'm going to keep on top of it too, and communicate with him. So we're going to make sure she's covered in all areas.
But this is the first time I hear about limping and the pain in the back. If there is pain, okay, that needs to be addressed. Okay. I hadn't heard about that, and I hadn't seen that in any other notes.
Well, when I asked Mom about it, she didn't even know she was doing that. Like I said, I've been watching her really closely. It was a very tiny limp. She didn't even know she was doing it. And when I asked her if anything hurt, she had to really think about it, just because there's so much discomfort in her chest and back and neck. She didn't even notice that she was having some in her hip.
If there were to be discomfort at a point tenderness spot in the bone, in the pelvis, it needs radiation. Now that's to be determined by you guys. Do you have pain or don't you have pain?
Okay, so it's more Dr. Melmed's department, it sounds like.
No, it starts with your mom.
And
she tells me often that she is hurting in her chest and back.
No. The point is that she's hurting in her pelvis to cause a limp. Because the pelvis is a bone that is weight bearing. So you're afraid of having a fracture.
Mm-hmm.
So if the spine doesn't hurt, and if the pelvis doesn't hurt, we have nothing to talk about. If it hurts, then we need to address it. And if there's point tenderness, then a spot of radiation in that point should take care of the pain like immediately.
Yeah.
Okay.
Yeah. And we're meeting tomorrow, so we can further discuss that, how to evaluate it and keep a watch on it. And then, because she's going to need to be calling the oncologist here pretty soon anyway. So, and you've got the portal, which we can communicate that with him. He'll respond to you. He said he's really good about responding to communication. So.
Well, good for him. I was terrible about that portal thing. Okay. All right, guys. I need to go. I got a call in 4 minutes. Any other questions?
Silva, for everything.
God bless you. God bless you.
Thank you.
Michaela, Mallory, Cindy, as always, on top of the game. God bless you. Thank you, guys. You're going to do great. You're going to do great.
Yep.
God bless you. Bye.